A new report is shining light on the dark reality of staff shortages in Manitoba's healthcare system. Experts say the numbers from October 1st to December 31st, 2022 show a growing trend of critical incidents reported across the province, with many having to do with a lack of people taking care of patients. CTV's Alexandra Hullock explains.
Death from delays and deterioration. Those are just some of the details revealed in a new document that delves into the critical incidents reported in late 2022. According to the data, between October 1st and December 31st of that year, more than 40 incidents were reported to Manitoba Health. Among those, 10 patients died while in care.
I believe those critical incidents are a direct result of the nursing shortage.
One patient's death was a result of a fall from a transfer device. Another died from receiving more than the maximum dosage for an overdose antidote. And a minor incident involved a minimally invasive procedure on the wrong patient.
When you're tired and you do not have the ability to provide oversight, that's when errors happen.
Experts say many of the critical events reported could have been prevented.
But when you don't have the staff to do that, then you see things like this happening more and more often.
But the number of incidents is only growing, even after the height of the COVID-19 pandemic.
It looks like there's been a steady increase throughout 22 as the pandemic waned, but we saw our staffing crisis intensify. And then as we saw the staffing levels decrease, we saw CIs go up.
In a statement to CTV News, Manitoba's Health, Seniors and Long-Term Care Minister Uzoma Asagwara says the provincial government takes every critical incident very seriously and will continue to implement solutions in the short term that will have lasting impacts in the long term. The minister goes on to say the province is already adding more hospital beds, as well as hiring and retaining more staff to help solve the healthcare crisis.
And so for now, in the short term, we just have to bolster and do the best we can to keep this healthcare system functioning until those long-term changes can happen.
And while healthcare professionals acknowledge the province's efforts, there are also financial concerns.
Efforts to balance the budget should not be done on the backs of patients or on the backs of healthcare providers.
Alexandra Hullock, CTV News, Winnipeg.
The Manitoba Association of Healthcare Professionals is issuing a stark warning tonight over lab services at Thompson Hospital. It says the hospital lab is operating 24/7 with only 2 technologists, putting patients at risk.
So you work 8 hours and then you do the next 16 hours of call. And so in that 16 hours of call, you may get called back into the hospital multiple times to do different types of tests during that 16-hour periods, and then your 8-hour day shift starts again.
That's MAHCP President Jason Linklater, who says the situation is simply unsustainable. He says the hospital is supposed to have 10 lab techs, and the 2 who remain are regularly working 24-hour shifts. Linklater says Shared Health must do more to recruit and retain health professionals in the north. CTV News contacted Shared Health for a response, but we did not receive one before broadcast. Lab technologists are responsible for performing diagnostic tests on patients in life-threatening situations such as heart failure, pregnancy complications, or injuries from accidents.